For years, the Labour Party accused the Conservatives of trying to privatise the National Health Service. This reached absurd heights in 2019 when Jeremy Corbyn made the ridiculous claim that Boris Johnson was going to sell the NHS to Donald Trump. It was precisely this sort of sentimentality and hysteria that has held back the NHS. But finally, the Labour Party has turned a corner. The Shadow Health Secretary, Wes Streeting, has declared, as if he were vying for a Tory leadership bid, that, quote, the NHS is a service, not a shrine. And he went on to say pouring more money in without reform would be like pouring water into a leaky bucket. We will also use spare capacity in the private sector to cut the waiting lists. Middle-class lefties cry betrayal. The real betrayal is the two-tier system that sees people like them treated faster, while working families like mine are left waiting for longer. That's the end of the quote. And while I think that the Labour Party is really trying generally to say as little as possible before the election, just hopes to win by not being Conservative, I think Wes Streeting has started a really important conversation, because it's with this that we can begin to fix the problem that the health service has. Now, you probably know that the NHS uses the private sector already to its advantage. GPs have independent contractor status, and while they are part of the NHS, they are paid separately and are not a formal part of the bureaucratic machine. In mental health services, the NHS has been using the private sector for residential mental health care for years, and it can work. Private contractors also granted for pharmacies, out-of-hour GP appointments, patient transport, diagnostics, and other things. The point is, none of this has threatened the principle of healthcare being free at the point of use. But there are other areas where we can use the private sector to help the struggling system along. The trouble is that for too long the conversation has always been, if we don't have fully nationalised provision and supply of healthcare, we will become like America. But this is nonsense. Other nations have devised healthcare systems that are free at the point of use, but don't necessarily have the entire system nationalised. Germany, that liberal paradise to which we are so often compared by the lefties, uses an insurance-based system that comes out of people's wages. It enables markets to compete while ensuring everyone is covered. Australia has better healthcare results, spends less as a proportion of GDP, and operates under a public-private model. Japan uses an insurance-based system, but ensures everyone is covered. It has better results than we do too. It's similar in Canada, France, and Belgium. Mr. Streeting said in his article for The Sun that the public doesn't trust the Tories with NHS reform. Now, if there were any truth in this, it's because of decades of fear-mongering from the Labour Party about privatisation. Even the Labour Party can now recognise that using the private sector to assist the health service, which, as I say, is already done to a considerable extent, does not mean privatising or getting rid of the free at the point of use principle, the basic tenet, then the Tories should now consider embarking on a radical agenda of healthcare reforms too, taking advantage of the opportunities that the private sector brings. Mr. Streeting may, to paraphrase Disraeli, have found us bathing and stolen our clothes, or perhaps the alternative Disraeli quotation is that we've got Labour men with Tory measures